So today we will talk about a scenario situation, which is mostly asked in interviews and in MCQs or in questions or in tests. And this situation is very important. And you must have a vision and understanding of how to answer this question and how to solve this situation in a practical life if you are a doctor or a nurse. So if the patient come in emergency with high blood pressure, that is 210 by 100, and patient is unconscious, what should we do as a nurse and as a doctor if the patient is presented and you are present? So what does it mean? If the patient is unconscious, it means the patient will not take any oral antihypertensive medication, because unconscious patient cannot eat and take any oral medication. So first of all, we have to assess the patient. If the patient is unconscious, then we will take a history of the patient from family or any other person, whether the patient is has a hypertension, history of any hypertension, and then we will ask the family member if the patient has taken its antihypertensive medication or not. First thing is this. Then if the patient is unconscious and patient is have a problem of hypertension, then we will assess for brain hemorrhage. So how we can assess the brain hemorrhage? We can assess the brain hemorrhage by pressure, by applying pressure on central way and on peripheral pain. So if apply pressure, we can apply pressure on central way, such a way that we will press chest, and if patient move all the limbs like both hands and legs, it means there is no sign of stroke. But if the patient moves only one side of hand and foot and the other side of hand and foot is not moving, it means the patient brain is affected. The other method is peripheral pain. We can apply peripheral pain by pressing the finger, whether to see if the patient brain is not affected by the hypertension. So this was all about assessing the brain hemorrhage. Now if the blood pressure is very high, so you can give labetalol injection. Labetalol injection is basically injection which is given 20 mg IV over 2 minutes initially, and then 40 to 80 mg IV over 10 minutes. And must remember one thing: labetalol is the injection which is not given in diluted form, it is given in pure form. This is very important question which is asked in the tests or papers, that which are the medications which are given undiluted. So labetalol is the medication which is given undiluted. So labetalol, we can give labetalol like this, or we can also give labetalol in a way that 1 to 2 mg per minute in continuous IV. And must remember, for labetalol, do not exceed over 300 mg. Then the other thing is diuretic. We can give diuretic, IV diuretic to the patient for like furosemide to 60 mg. And the other thing is, if patient is conscious, then tablet capatin, generic name is captopril. Ask the patient to take this medicine, which is 25 mg. Okay, so now what are the nursing interventions we have to take? So first of all, we have to assess the patient, and we have to see all the sign symptoms of the patient, like if the BP is very high, like 210 out of by 100, then the patient have sign symptoms like headache, dizziness, altered mental status, shortness of breath, chest pain, decreased urinary output. Maybe the patient has decreased urinary output, that's why BP is very high, and vomiting and changes in vision. So what are the nursing interventions? The nursing intervention is monitor BP frequently, like 5 to 10 minutes. After every 5 to 10 minutes, you have to monitor BP came to its normal values as the physician said or not. The other thing is medication. If the doctor is available, as a nurse you can give medication as prescribed by the doctor, but if doctor is not available, you cannot give medication to the patient. The other thing is use 2 large IV cannulas, and you have to cannulate the patient. So whenever doctor prescribe any medication, you all the medications, and there will be no hurry at that time. And you have to check the oxygen saturation of the patient, and if oxygen is low, then provide oxygen to the patient. If BP, high blood pressure haven't affected heart of the patient, and heart there is no heart attack, you have to take limit the fluid intake. If the heart is affected, and assess the ECG of the patient, and check X-ray report, and listen murmur sound of the heart. And in case to see whether the lungs are affected or not, you have to check rails and cracker sounds of the lungs. Then see if the patient has edema or not. Check because BP affects the organs. Okay, so you have to see whether it have affected heart or lungs or any kidneys. So you have to check any edema or RFTs. Now you should ask the patient to take rest and provide a quiet room, and educate the patient to how to lower the stress. Educate the patient to take a diet which have low salt, and have some exercise in life, and must have a healthy eating habits. And you have to educate patient on importance of taking antihypertensive medications. And as a nurse, you when to seek help. So if the patient has consciousness, and if the patient is unresponsive and if BP is more than 200 by 100 despite treatment, then you have to take help. So this was all about that nursing management, and when the patient blood pressure is very high, what to do in the case when doctor is not present. And this is the question which is very important, and asked in all the exams and questions. So you have to know all these signs and symptoms of BP. So thank you so much.